What is body fat and why is it important? To understand why body fat percentage is important, we first need to understand what it is. Our bodies are composed of many different components: bones, muscles, body water, organs, and of course fat. Fat percentage is the ratio of fat in relation to those other components. Now, although fat gets a bad reputation, it is essential for many of our body functions. It helps maintain life and reproductive functions, and the accumulation of adipose tissue from stored fat helps cushion and protect the organs in your chest and abdomen. So having accumulated fat is important, but like everything in life, you need to maintain a balance. That is why calculating body fat percentage is so important in identifying your health. Having a body fat percentage that is too high or too low can indicate certain health risks. How do we calculate body fat percentage? There are several methods to calculate this. Here are some of the most common ones. First is calipers. It is based on the idea that around 50% of the total body fat lies under that skin and involves measuring the thickness of skin folds at standardized sizes. It is also known as skin fold method. Body mass index. This is a value derived from the weight and height of a person, a simple numeric measure of a person's thinness and thickness. Having a numeric value allows health professionals to discuss weight problems more objectively with their patients. We use this system at our cult centers. Dual X-ray absorptiometry, DEXA, uses X-rays to scan and measure the whole body bone mass and soft tissue composition, and is the preferred method for identifying bone and body composition. Bioelectrical impedance analysis, BIA, uses an imperceptible electric current to measure body composition. Body fat or adipose tissue causes greater resistance and slows the rate at which the current travels through the body. Hydrostatic weighing, an underwater weighing method based on the Archimedes principle. A person weighs themselves on land and water. The difference between the two values can help determine body density and fat percentage. Though this is considered one of the most accurate measurement methods, it requires a lot of resources and space and is therefore not the most feasible. USDD method calculates body fat by using a person's height as a constant and girth of the neck and abdomen for males and neck, hip, and waist for females. What does your body fat percentage tell you about your health? Using any of the above methods can give you an idea of your body fat percentage, but the number alone doesn't tell you much unless you know how to interpret it. Here's what the body fat percentage means according to the American Council of Exercise. As you can see, values differ for men and women, and there are further differences if you break these groups down by age. You may have noticed the term essential fat. This refers to the fat present in the bone marrow, nerve tissues, and organs, and can't be lost without compromising physiological functions. The chart above shows that women need to have higher essential fat percentages, as these fats are very important in maintaining hormonal balance and aiding and protecting the reproductive organs. How and when do these values help? These numbers are useful in determining whether a person is underweight, at a normal weight, overweight, or obese, which can have a direct link to their health. Higher body fat percentage is linked to a myriad of health issues, including cardiovascular disease, hypertension, insulin insensitivity, diabetes mellitus, and even certain types of cancer. If your body fat percentage is too low, you're at a risk of anemia, malnutrition, osteoporosis, low immunity, and if you're a woman, then fertility issues. Knowing your body fat percentage can also give you an idea of how fit you are and what you need to do to work towards your fitness goals. How to reduce body fat percentage? You can reduce your body fat percentage by reducing your overall weight. There are many ways to do this in a healthy way without going on a hunger strike. Caloric deficit. Consume fewer calories than you burn. Everything you eat is converted into fuel for your daily activities. When you consume more calories than you can burn, it is stored as excess fat. You can prevent this with a caloric deficit of about 10 to 20%. Of course, this doesn't mean you cut out all high calorie foods from your diet. Remember, your body needs calories for day-to-day functions like muscle repair and sustained energy. You want to make sure you have the right kind of nutrients, proteins, carbs, and even fats in your daily diet to stay functioning throughout the day. Exercise. Focus on cardiovascular and resistance training. A low-calorie diet alone isn't enough to reduce weight. It needs to be complemented by the right workout. Cardiovascular and resistance exercises are great for this because they help build and maintain lean muscle mass, which in turn reduces body fat. Weight training is particularly important in your fat loss journey because when done properly, it creates a greater caloric expenditure than the steady state cardio. And don't forget, consistency is the key in maintaining both muscle gain and weight loss. Lose fat, not muscle. Weight loss doesn't necessarily mean loss of fat. Losing weight signifies a loss in total body mass, but this doesn't mean you're reducing your stored fat. Loss of lean muscle mass or less water retention can also result in weight loss. Keep in mind that you can only lose body fat by following a caloric deficit and a good training program. In fact, research shows that fat loss without sacrificing muscle is more effective when caloric deficit is achieved through training. Keep track of the calories you consume and the activities you do, and find the right balance between the two. If you find your caloric intake is high and your activity level is low, look into increasing the level and frequency of the workouts. If you feel like you're doing the right amount of exercise but you're still taking in too many calories, it may be time to make some dietary changes. Choose wisely to make sure you are not losing valuable muscle mass instead. Bottom line, body fat alone is not an indicator of health, although it is a main component. A person's lifestyle, metabolism, and workout regime are other indicators that can provide a more holistic view of their health. That being said, body fat percentage is an easily quantifiable metric that can give you a good idea of what it will take to achieve your fitness goals. If nothing else, it's a friendly benchmark for your weight loss journey.